Hello, everyone. My name is Giovanni Nogales, and I am a paralegal here at Laos Parker. Welcome to today's webinar hosted by the Texas Association for Home Care and Hospice. Today's webinar is entitled Workplace Violence in Home Care, Protecting Your Patients and Staff. Today's presenters are Richard Pecore and Les Johnson. Just a quick reminder, if you have any questions throughout the presentation, please feel free to type them in the chat box and we will address as many as possible at the end of the presentation. So without further ado, I present your speakers, Richard Pecore and Les Johnson.
Hello, everybody. We're glad to be here again today. We enjoy working with Texas Association of Home Care and Hospice. We got a lot of material to cover today, so Les and I are going to get started right away. Of course, this is general purpose information. It's not meant to address your specific situation. If you are in a legal situation, you need to seek out counsel. We're going to cover the presentation in the following sequence, more or less. We're going to talk a little bit about how prevalent is workplace violence in a healthcare setting, who commits it, examples of violence against home care workers, and violence that should be by home care workers, patient abuse situation. Prevention of violence, and that's important now, and Les will cover that because there's been a couple of changes in Texas law very recently that's going to affect that. What you do if violence appears imminent. What can you do? You're going to find out a lot of that has to do with getting out of the situation or being observant before you get into it, hopefully. Prevention policies and procedures, that's going to be part of the changes in Texas law that Les is going to talk about. Elements to include in your workplace violence prevention policy. A nurse's workplace violence prevention course, which is available to y'all for training. A section on yikes to make you aware of some of the problems and penalties. Changes in federal law, changes in state law, the COVID-19 impact, which you're all aware of. Tips to reduce risk, the do's and don'ts, and some additional resources for you, then we'll take questions. Next slide, please. I'm going to talk kind of quickly, so if you have problems hearing me, just raise your hand there in the chat box and flag me to slow down. So what is workplace violence? Well, it's any act or threat of physical violence, harassment, intimidation, or other threatening, disruptive behavior that occurs at the work site. It can affect workers, clients, customers, and visitors. What's a workplace? Well, that can be anywhere. That's any place that is work-related as far as your duties. It could be office building, patient's home, parking lots, or travel to and from. Examples are verbal threats to inflict bodily harm, whether it's overt, covert, or vague, aggressive physical acts, verbal harassment, or disorderly conduct, like shouting, throwing things, slamming doors, punching walls. You've all been around it, so I don't really have to tell you what it is. The question is what to do about it. Next slide. Well, the first thing you try to do is get a handle on your industry. OSHA defines healthcare and social service workers as a high-risk industry. In fact, it's number 2 behind correctional officers. I don't know if you knew that. Next are late night retail establishments like stop and goes and hold up, and then taxi drivers. In January 2017, OSHA started publishing inspections and issuing citations related to the occupational exposure to workplace violence in these high-risk industries. And last May, the National Nurses United website reported survey of more than 2,500 hospital nurses found that 48% of the RNs had reported either a small or significant increase in the workplace violence since the year prior to that. And there's the link if you want to look at the study. Next slide, please. According to Lisa Tenney, who's an RN in the Maryland Emergency Nurses Association, she says, I've been bitten, kicked, punched, pushed, pinched, shoved, scratched, and spat upon. I've been bullied. I've been called ugly names. I've had my life and the life of my unborn child threatened and other family members threatened. It required security escort to my car. I'm sure that Many of you have experienced some, hopefully not all of that, but that's the environment you're in as far as home health and hospice. It's the potential for it. The prevalence of workplace violence in healthcare is very, very high. The last year, July 2022, the DOJ's National Center for Justice released a report called Indicators of Workplace Violence for 2019. Almost 18,000 workers in the healthcare industry were victims of workplace violence in the 27 years between 92 and 2019. And the report found that workplace homicides had fallen more than 50%. So what we're talking about probably is more physical pushing, shoving, punching, things of that nature, or non-physical acts. Next slide, please. Things like verbal abuse and the like. Per OSHA, more recently here in the last 11 years or so, up to 2013, the violence accounted for nearly as many industries as all other industries combined. That's 4 times greater than the average U.S. worker. And it underestimates probably overall workplace violence because it only reports time away from work. A lot of times these are underreported because of fear of retaliation, unintentional assaults, persistent perception that workplace violence is part of the job. Basically, it may be underreported as much as 70%. Next slide. So if anything, it's probably worse than the report. CDC report found that workplace violence had nearly doubled for nurses and nurses assistants between 2012 and 2014. Nurses experienced more non-fatal incidents of workplace violence than cops and correctional officers. And the New England Journal of Medicine said there were 154 shootings with injury, either inside or on the grounds of hospitals between 2000 and 2011. And homicide is the leading cause of death in the workplace for nurses and employees in personal care facilities. Next slide. What does all that mean? Well, it's just examples of spikes and incidents that have to do with this. But according to the Department of Labor statistics, between 2021 and 2022, in the last 2 years, healthcare workers account for 73% of all non-fatal workplace injuries and illnesses as well. And that's the COVID-19 effect that we've seen. Verbal abuse, physical abuse, threats, stalking from patients, family members or friends of the family. Those are all forms of non-fatal violence. In 2018, about 75% of the reported workplace assaults took place in healthcare and social service settings. The most common type of violence in healthcare is patient visitor to worker. So you're more likely to incur an incident of violence against you than you are in the setting where the patient is being hurt or injured by a worker. Next slide, please. This is just a table that reflects some of the spikes that we've seen, sort of a visual aid, looking at the incident rates for healthcare support, in particular, nursing, psychiatric, or home health aides. You've seen the trend here. 2019, there was a spike up to 21%, but you see the numbers, over 10,000 incidents there to the side, that first block of red. And you see down in the bottom block there, law enforcement officers and cops, basically, they're doubled at 42%. But look how many fewer incidents there are, less than half of what happens in the healthcare industry. So the frequency is high, and you're more likely to have something non-fatal occur in the verbal variety, or somebody throwing something or punching a wall, than you are to actually be struck or physically injured. But you are likely to see something like that happen. Next slide, please. And here again, just pointing out, if you're female, you're twice as likely, at least from the 2019 statistics, to have some form of violence, whether physical or non-physical, occur to you in the healthcare industry. And interestingly, if you're quite young, between 20 and 24, and I can say that because I'm an oldster, you're probably, as a result of the cases you've been assigned, less likely to incur a violent incident. As you gain more experience, ages 25 to 34, you're assigned more difficult cases, more cases requiring more experience, how to handle folks. And look how the incidence jumps 3 times. And if you're in the 35 to 44 age group, you see a slight drop, but basically those 2 blocks between the time you're 25 and 45 is going to be the bulk of your career when you're more likely to see something like that happen. It really doesn't start dropping off until you hit your mid-40s. Length of service on the job, again, the longer you're there, and I think that has to do with the kind of cases you're being assigned. You see it jump just in a very short period of time. When you're first starting out, it's not nearly as large, but it jumps twice. And then it jumps twice as frequently again after you've had 5 years on the job. So it's something interesting to know going forward, especially for new nurses that are going out on healthcare settings. Just be aware it's likely to occur. So the rest of the presentation where we talk about what to be aware of, what to watch out for, that's going to start mattering to you the longer you're on the job. Next slide, please. So who commits violence by patients and their families? Could be somebody dissatisfied with the care they're receiving or mad about something completely different. Who knows? Violence by family members or friends of employees or staff. You see the friends of the family. They got a personal relationship somewhere in here. You see it a lot with the marital disputes or child custody disagreements. If there's something else going on in the family that's going to create tension and stress, it's likely to trigger some violence. And of course, I call that violence against the nearest available target. And you may just be the person who's unfortunate enough to be in the line of fire, figuratively speaking. Violence by a stranger, it may be somebody committing an unrelated crime, trying to break in while you're on a night call. Who knows? Just be aware that's where it could come from. It's just wide open from any source, so be aware of your surroundings. Next slide, please. So what kind of person is likely to be a perpetrator? Oh, let's look at problem employees. It's frequently a white male between 30 and 40 years of age, history of violent behavior, exhibits paranoid behavior, can't handle criticism, possible substance abuse, anyone who's obsessed with guns, excessive interest in media reports about job violence, frequently complains about poor working condition, might have an unstable family life, and is usually a loner. Next slide. So there was a study called the Workplace Violence Against Texas Nurses Survey done not too long ago, where it identified 2 groups who committed the various types of violence against home health agency nurses. These were patients were the most commonly reported groups who committed acts of violence, physical violence against nurses. The family members or friends were more likely to commit other types of violence, anything except physical. They'd be the ones yelling, throwing things, punching walls, that sort of thing. So if you catch violence, it's more than likely going to come from the patient than it is from the surrounding folks. Next slide. So what kind of factors can you look for? What are some of the risks that you can make yourself aware of and keep an eye on? Well, you look for patients with a history of mental illness, violence, drug abuse, or alcohol abuse. You're going to you have your red flag patients. Working alone in patient's home or facility. If you have a situation or a patient who has got a poor history along the lines of violence, at least you can request someone to go with you and try to lessen that risk. Poor emergency communications in the homes. You know, if they don't have 911, that's why you have your cell phone available. Maybe they don't have a phone, or it's just out in the middle of nowhere. Weapons among the patients of family members, neighborhoods in a high crime rate area. So you're aware of that going in. And again, that's another reason to try to ask for someone to go with you instead of going solo. Healthcare agency risk factors, a lack of agency employee policies and staff training. You're going to see that come up again. Texas is taking the lead now in requiring policies and procedures on this sort of thing, and it's going to go into effect by, well, less than a year now. So that's going to be changing. Poor security staffing. A lot of agencies don't even have any. Lack or absence of restrictions or unauthorized access to agency offices. This is your signage, your electronic or physical barriers. Try to keep them out of the facility. No notice to staff, patients, families, or others that violence won't be tolerated. You have your signage up there again. So that's the agency itself. Next slide, please. And some examples, we're going to talk about a few. This one's Integra Service Connect, where OSHA ruled that they failed to protect an employee from workplace violence for one reason, because they didn't have any policies or procedures in place. Florida home health caseworker was stabbed to death by a patient, and it turns out that this patient had a history of violence. She said she was very uncomfortable in his home and wound up going there alone. The patient had a criminal history, had served time for aggravated assault. Police had received just tons of reports about him over the last several years. They said the employer knew about it, knew he had criminal behavior, tendency toward violence, schizophrenia, paranoia, but took no steps to protect its employee. So there wasn't any training, there wasn't any assistance provided, there wasn't any effort to try to make the visits during the day or when another family member might be available, that sort of thing. And then they found multiple incidents where the same sort of thing was going on with other patients, and that Integra didn't do a hazard assessment. They didn't have a written policy or plan of procedure on how to deal with or prevent it. And that all weighed into OSHA's decision. They issued 2 citations, and this was back in 2013. The fines came to over $10,000. These days, if there are 2 citations, it could be as much as $120,000, because you've got CMPs that can weigh into this now, civil monetary penalties, and those carry a hefty whack. Next slide, please. OSHA fined another national pediatric healthcare provider $98,000 for failing to protect their home care workers from physical sexual assault. This was an outfit called And Adventure, doing business as Epic Healthcare Services. And an employee was sexually assaulted by a home care client after the company had been warned by other employees of the same behavior. It had gotten numerous reports on verbal, physical, and sexual assaults, and they just ignored it. They cited the company for one violation related to employee exposure to violence in the workplace, including physical and sexual assault, and also for failing to record the injuries properly in their OSHA forms. What you're seeing is this is what's been addressed by recent changes in the law. They're trying to pass on the federal level. Texas already has. Pardon me. Next slide, please.
All right, is this where I'm taking over, Richard?
Oh goodness.
I'll finish up through the end, I guess.
I'm okay. I just had something caught my throat here. Let me finish this last slide here, Les. I appreciate it.
All right.
The last section, be examples of workplace violence. Again, home health care patients, patient abuse. This is unusual, granted, but I want to cover an important point here. In Oklahoma, a home health aide was charged with murder after his patient died. Following an apparent assault, the aide admitted to hitting the patient 30 times with an open fist, squeezing his head and smacking him with a bag. We don't know what was in the bag, but the point is this is someone who obviously lost control. And in Texas in 2018, a Dallas home health aide was accused of fatally smothering an elderly woman and attempting to kill 2 others. North Texas police reported over 750 unsolved deaths of older adults because they thought they might have a serial killer on their hand. The point of this is that this is also the reason why your home health agencies and hospices must do their background checks and their exclusion checks, not just because it's required by law, but for the safety of their patients. I'm going to hand off now to Lester. Les Johnson is a partner with the firm and has a ton of experience in this sort of thing. He practices in Louisiana, but workplace violence is pretty similar everywhere. So Les, take her away.
All right. So we're going to start with some tips that are provided by NOSHI, the National Institute for Occupational Safety and Health. So basically just tips to avoid and manage potential and actual violent situations during home visits. So they say start off with considering working with an escort in high crime areas, and if possible, schedule your visits during daylight hours. Obviously, most crimes occur during at night. Know the location and accurate directions to your patient's home. So this is, I guess the agency should probably, for new patients, provide a little bit of education and information to any new employees going to an area that they know is a difficult area. And if you see your employer not doing that, but you see a coworker who maybe needs to know, just tell them. So inform your coworkers the location when you expect to report back. So everyone should know that you've gone to whatever dangerous location, and you need to have basically someone kind of watching your back. Drive alone. If driving alone, keep your windows up and doors locked. Park your vehicle in well-lit areas away from large trees or shrubs or anywhere else that people could hide. Some of this is obviously common sense kind of things, but keep your equipment, supplies, and personal belongings locked out of sight in the trunk of the vehicle. That's actually also a risk area when you go to get out of your car and get into your trunk. You need to kind of look at your surroundings and just be aware of anyone who's approaching. If you feel uneasy, just don't get out. You can always leave and come back another day, but you can't necessarily undo that if you have if you get attacked. So let's go on to the next slide. So do your paperwork and documentation inside before you go back out to your car. Definitely don't do it in your car. You're just kind of a sitting duck waiting there for someone to do something. Carry a personal alarm or noisemaker, like a whistle. Only carry minimal amount of cash. Always carry your ID. Make sure your cell phone battery is fully charged. Obviously, that's important so you can communicate with your employer or anyone else, so you can make a call for help. If you notice anything threatening your security, again, just stay in your car or leave, frankly. During the visit, use basic safety precautions. Evaluate situations for possible violence and watch for signals of impending violence. Just look and see, read the room, basically. There are people arguing and fighting inside the house that you're visiting. That's obviously a problem, but also outside of the home. You don't want a lot of people fighting in the front yard and arguing or whatever, and drinking or doing drugs, and then you're trying to walk past them to do your job. Notify your employer if you observe any unsecured weapons in your home. I think I said this last year. In Texas and Louisiana and lots of other states, there's lots of times there's going to be a gun somewhere in the home. But what we're talking about here is, gun out on the living room table, or the client's family member or someone decides they want to start cleaning their weapon during your visit. You need to get out of that kind of situation. If they're going to take risks with weapons, you don't have to take those risks with them. So that's, even if they're being reckless with what firearms and it's not violent at all, it's still a danger to your health. So you should try to remove yourself from that kind of situation. Let's go on to the next ones. Next slide. All right. So maintain behavior that helps you diffuse anger, which is important. So obviously don't argue with people. You acknowledge their feelings, present a calm, caring attitude. Definitely do not threaten them. You never really want to trade barbs with anyone in the field. This is you're just doing your job. They're doing whatever it is they do, and you have no reason to take any kind of risk with your own safety. And that's also watch out for the safety of your patients too, because sometimes there's just dangerous situations that don't involve them, and you want to watch out for everyone. So avoid behaviors that may be interpreted as aggressive. For example, don't make any sudden movements or closing too close, grabbing people, touching, or speaking loudly. Trust your judgment. Avoid situations that just don't feel right. If you're being verbally abused, just ask them to stop and then leave if you can't get them to. But if you can't get in this anytime you can't get control of the situation, just leave. That's your main go-to option for anything that's shady or actually dangerous. You can always call 911, obviously, but you want to, I guess, you want to de-escalate. So you don't want to call 911 right in front of someone and say you're calling cops at them, yelling at them. That probably would get them upset as well. But you do what you have to do. If you must, you can. But you don't want to threaten them. You don't want to argue with them. I would say if they're arguing about the care that's been provided, be their advocate. Side with them and tell them that you'll look into it and you'll work with your employer to fix whatever problem it is they have. Just don't get into an argument where you're trying to say take up for your employer or anyone. Just don't argue with them. Let's go to the next slide. All right. So again, if violence appears imminent, remain calm. If they're yelling, obviously remain calm, speak in a measured tone of voice, remain respectful, listen attentively, get help, don't be a hero, and if possible, escape. So there's your golden rules, I guess, for when it looks like things may be going south for you and violence may be imminent. Go to the next slide. Okay, so there was a survey of Texas nurses in 2015 on workplace violence, and they were looking at how many people have experienced workplace violence, and they were also looking at the employment situations, whether their employers had policies and procedures related to it, whether they had training or not. So the employers' responses showed 71% of the home healths have implemented workplace prevention policies. Now, whether they're adequate or not is another story, but they claim that 71% of them have policies on that topic. 73% provide workplace violence prevention training. There's lots of trainings available online that you could just get for free, or your agency could. You could create your own, but again, there's resources everywhere. 66% conducted risk assessments of work areas where they actually examined I guess their corporate office, I'm sure, and then the various places for home health where they see patients. 87% require reporting of incidents. I'm guessing some of these answers aren't completely. I would imagine more would require reporting of incidents, but anyway, 87% on that. 92% investigate reported incidents. I wonder who doesn't investigate incidents, but anyway, 92% investigate them. So on for the employers offering refresher training to nurses, 66% offer workplace violence awareness training, 48% offer training on de-escalation techniques, 45% offer training on evasion techniques, 49% on containment measures, 57% on identifying characteristics. So you'll see there's a lot lower percentage that offer, I guess, topic specific, techniques, training that get that specific, but more of them did overall trainings. So elements to include in your prevention policy and workplace prevention policy are management commitment and employee. You really want to show a commitment to safety and employee involvement in both the creation of the plan and its rollout. You want a policy statement, basically just stating that it's the company's policy to maintain a safe environment for all of its employees and patients, and to mitigate any risks where they're found. You have a threat assessment team that would work to basically figure out where all your largest threats are, which is alongside, I guess, workplace risk analysis. That's what they'll be performing. You'll do program evaluations on how well your policy is. I guess people are reporting how well things are being followed up on. You'll have training, required training, incident response, active shooter policies, and obviously record keeping. So you'll want to have policies that detail the requirements for documenting incidents and the investigations that were done. Go to the next slide, I think. Okay, so the Nurses Workplace Violence Prevention course. So they've got this free interactive course. Like I said, there's lots of resources online. NOSHA's not the only place to find them, but it's one good source. They've got a free interactive course that highlights real life workplace violence incidents. The course is intended for healthcare professionals, nurses, and physicians, but it's available to anyone. It's got 13 modules to take. They're about 15 minutes each, and there's a post module test. And there's a link here to the free trainings. Let's go to the next slide. All right, so this is basically just in the contract, the community services provider agreement, and it says it's responsible for the behavior of its staff and its subcontractors to ensure a violence-free contractual relationship. The contractor understands that any remarks, gestures, or actions towards system agency employees, volunteers, or clients that carry an implied threat of any kind, even if intended in jest, will be taken seriously and may lead to corrective action up to and including terminating this contractor. So this community service provider agreement, I mean, it requires you to report even jokes and take action against those. So, or that it says that they will. So you'd be a fool basically to joke about violence or anything along these lines. There's a couple of examples here about Packers players joking about bombs in an airport, and it's the same kind of thing. Just we don't want to joke about violence. We want to take it seriously. We don't want. If you think about it, if you're looking at it from an agency management standpoint, if there's an atmosphere at your place of employment that allows joking about these sorts of things, and something does one day happen, eventually there's going to be a plaintiff attorney who's going to subpoena people, and they're going to find out about that, and they're going to make the entire organization look bad when really it was just jokes. But it can cost everyone a lot and be hard to answer for after the fact when something actually happens. It doesn't show any commitment to maintaining a safe place of employment when you've got almost a kind of locker room kind of atmosphere where everyone jokes about it, and then lo and behold, something happens. So anyway, we'll go to the next slide. So don't joke about violence. It's a contractual requirement as well as it's just wise. So let's see, new changes in federal. Also, Richard mentioned this. This is the Federal Workplace Violence Prevention for Healthcare and Social Services Workers Act, which is still pending. It's passed the House. It's got more support in the Senate, but hasn't yet been voted on. White House supports it. It will require annual workplace violence training to employees and staff, for investigations for violent incidents. You'll have to develop violence prevention plans that include risk assessments, hazard correction, and infrastructure upgrades, like lighting outside in the parking lot, things like that. Maintain and retain related records for at least 5 years. Report and evaluate information as required by the OSHA 2016 guidelines for preventing workplace violence for healthcare and social service workers, which recommends the following: management commitment and employee participation, worksite risk analysis, tracking and trending, hazard prevention and control, safety and health training, record keeping, and program evaluation, which we had mentioned actually earlier. We'll go to the next slide. Okay, so Texas. Changes in law. Abbott signed the Workplace Violence Prevention Act of 2023. So it was effective September. So no fines or penalties, but disciplinary action may be taken by licensing agencies for noncompliance. So I guess this could be basis for like a general duty OSHA citation and possibly civil monetary penalties. Facilities include home health. So I guess that would be both the, well, it'll be all of your workplaces. So it'll be your actual corporate office, as well as some responsibilities for your other workplace sites like homes. Nursing facilities with 2 or more RNs, hospitals, mental health, ASCs, and freestanding EMS centers. You have to form a committee of 1 RN, 2 security service employees, and one physician if one's already on staff. Looks like you don't have to hire one, but they all have to get together and develop your workplace violence prevention plan. So you establish your policies and procedures in response to incidents, including firearms and any resulting injuries to employees. You conduct your annual employee training on the plan and policies. This is obviously nothing to complain about. There's like 1 million annual trainings nowadays, but this is a good one, and one that will actually, may save someone's life one day. Let's go to the next slide. All right, so then there's the Reporting Workplace Violence Act of 2023, took effect September. It must post a notice to employees of the contact information for reporting instances of violence and suspected or suspicious activity to the Texas Department of Safety, and inform employees of the right to make an anonymous report. The notice must be posted in a conspicuous place in the employer's place of business. Also another thing that we have a lot of. So this will go up by your HIPAA notices and things like that, alongside all the other notices. You have to have it in sufficient locations to be convenient to all employees and be in English and Spanish as appropriate. Law takes effect September 1st. However, the legislature has until September 1st, 2024 to post the form of the notice, so enforcement is unlikely before then. So after TWC issues the prescribed notice, the Texas employers must post the notice as required, which would include posting not only in their physical work locations, but also electronic locations for like websites for remote employees. All right, let's go to the next slide. So remember this one, there are 2 significant changes in 2021 to sexual harassment law coverage in Texas. Well, SB 45 became effective, and it expanded the definition of employer to include individuals and business entities of any size, which expanded the potential liability for sexual harassment to every Texas employer. Previously, liability was limited to employers with at least 15 employees and only businesses, not individuals, which was basically what federal law required. But Texas has now opened the door to individual liability for solo practitioners, professional services, as well as, say, consultants or something like that, any kind of sole proprietor. Let's move to the next slide. So the time to report sexual harassment incidents, the other update, in Texas has increased from 180 days to 300 days, 10 months, from the date of alleged conduct. So that was effective on 2021. So the revised Texas Labor Code calls for liability if there is a claim for sexual harassment and the employer knows or should have known of the conduct was occurring and fails to take immediate and appropriate corrective action. Focus on the immediate part there. Don't wait a week, don't wait 5-6 days, take action right off the bat. While Texas law does not define what corrective action should be taken, administrative policy changes and training, retraining will be examples of the types of things you would have to do. Sometimes you may have to fire someone. For example, anti-harassment training and regular workplace social interaction training for employers and managers, which is designed to prohibit and prevent discrimination and harassment in the workplace, will be an important corrective step to help better manage these steps. But again, sometimes you got to go further than that. Obviously, you just have to kind of gauge the situation and find out what was alleged to have occurred and how I guess harsh of a corrective action should you take will be based on that. So regular updates to your compliance plan and training should be made to incorporate any legislative or regulatory changes. Obviously, that's kind of goes without saying, but they're constantly tweaking these little requirements, and these are the kinds of things that are real easy to, I guess, forget. This and things like ADA compliance. It's not what you do is your main job in healthcare. You care for patients. You're not in the business of regulatory compliance. So it takes an active effort to watch for changes in the law and try to incorporate those into your policies as you go. It's just, you have to have people on your team that are constantly watching that kind of thing. Probably multiple people in different areas, like HR looking for these sorts of things, and nursing for obviously clinical requirements. So COVID, obviously we just got through a nightmare there, but we saw lots of violence and violent threats and things like that over COVID policies and other infection control policies. it may be something different in the future. It may be a different virus, but the same sort of thing will pop up and be, I guess, an issue. So prevalence against workplace violence against healthcare workers during the pandemic shot up dramatically. They showed a increased prevalence against home care workers, both inside and outside of the hospital setting and during the pandemic. So they concluded that workplace violence has possibly deprived some of quality nursing care and caused psychological stress among healthcare workers and possibly endangered some patients' lives by increasing the risk of medication errors or delayed care even. Therefore, it's necessary to protect healthcare workers with proactive measures to protect them in a similar crisis in the future. So workers may be threatened or assaulted as businesses try to put in place either COVID or other infection control policies. We're talking mask uses, social distancing, limits on the number of customers. The one that I thought in my world impacted my clients the most was with nursing homes and hospices not allowing loved ones to come and see their family members in their last days. That was obviously difficult to even prevent these people from seeing their loved ones, but it created several angry situations that had to be de-escalated. So, and I'm sure all of you
Les? You still there? You muted. Gio?
I'm still here. I think he might have cut off.
Yeah, it may have dropped. East Coast finishing here. Let's go to the next slide.
There we go. More tips. So offer customers the option to minimize their contact with others and promote social distancing. These options can include curbside pickup, personal shoppers, home delivery, things like that. Post signs that let customers know about the policies for wearing masks and social distancing and the maximum number of people allowed. Provide employee training on threat recognition, conflict resolution, nonviolent response, and any other related topics related to workplace violence. Put in place steps to assess and respond to workplace violence. Remain aware of and support employees. Assign 2 workers to work in a team and encourage COVID-19 prevention policies to be followed if staffing permits. Install security systems. Identify a safe area. I tell people also just, try to manage. You can have your policies and you can say whatever it is they say on masks or whatever, but when someone comes in and they're angry and they're not wanting to wear a mask, you really need to figure out, can I deal with this person and get rid of them quickly and without having to directly confront, or do I really need to get in there and force them to wear a mask? Sometimes people would, I guess, make a situation worse enforcing a rule and get all up in someone's face, and that's obviously not good for infection control. But sometimes you just have to, I guess, be willing to bend the rules just to make a situation go away or de-escalate. And I found a lot of times with strict COVID policies didn't allow that very well, and we would end up in a worse situation or more, I guess, confrontational situation, just in this, I guess, desire to enforce every single letter of the rule when we could have just asked someone to leave, for instance. All right, let's go to the next slide. Do's and don'ts. Do attend all employer-provided trainings on how to recognize and avoid potentially respond to violent situations. Do report perceived threats or acts of violence to your manager or supervisors or other employees, following any existing policies that may be in place. Remain aware of and support coworkers and customers if the situation occurs. Don't argue with the customer, or if they make any threats or become violent. If necessary, go to a safe area. Don't try to force anyone that appears upset to follow or violent to follow COVID prevention policies or anything related to other infection control issues. Let's go to the next slide. All right, so additional resources for everyone. There are OSHA guidelines, links for that, and then a roadmap for healthcare facilities from 2015. There's another one called the Big Picture, another 2015 file. Louisiana Department of Health has resources as well, and there's links to that, and their workplace violence prevention signage. Oregon has a HCA study 2015 says against home care workers and its relationship to other health outcomes. It's a cross-sectional study, I guess. So it's just something to kind of help you understand the, I guess, connection between the relationship between workplace violence and the health of your workers, and I guess efficiency of your overall business as a healthcare provider. Go to the next slide. Oh, that's it. So I guess if we have any questions, we've got time to do that and go over anything else.
No. So it looks like we don't have any other questions. They're just wondering if they're going to get a copy of the PowerPoint slides, which I was going to get through. Do you guys have any more information that you guys want to give out before we close it?
There's just one thing I wanted to mention. Les had brought this up last year. If you're in a situation where your car conks out or it just won't start, for heaven's sake, don't wait out there by the car, especially if it's getting dark. Go back inside, make a call, or if it's just a situation where the car's not acting right, call Uber, call a cab, do something else. Don't be afraid to leave the vehicle. You may not like it, but it's not worth your life. Better for you to get out of there safely, come back for it during the daytime.
I got one question that just got put in. It says, are we able to ask if the patient has a gun when the nurse are making home visits?
I suppose you could, but you might, I mean, if no one's brought it out and you have no reason to know that there is one, I suppose that could possibly upset someone. I don't know. But I don't see any reason why you couldn't. Richard, do you have any ideas on that?
Yeah, my thought is you might actually trigger somebody. So I'm with Les. If you don't see one, I wouldn't bring it up because I don't know. Somebody might be offended by that and say, what, you don't think I can have a gun? And next thing you know, you've escalated a situation that didn't even exist, a minute ago. Mm-hmm. So I think you let sleeping dogs lie and you just don't deal with it. Look, if you're in Texas or Louisiana, like Les said, you probably ought to assume there's a gun in the house somewhere. But unless it's laying out in the open or somebody's carrying one, I wouldn't be worried about it.
Yeah, it just may be impossible to avoid. So asking about presence may not, I mean, you may just find out all the time. And if you're worried about it, you're going to make yourself nervous.
Yeah, and if you think there is a risk of someone being armed or maybe doing something, or you're just worried that somebody has a gun, just like Les said, leave, reschedule, tell them, I've got a conflict, I got to come back. I'm sorry.
All right, I'm going to start closing it out. So that concludes today's webinar. Thank you for joining us, and thank you to our speakers, Richard Pecore and Les Johnson. Everyone from today's webinar will receive copies of the presentation slides via email, and those will be sent out tomorrow. And if you have any other further questions about today's discussion or another healthcare law issue, please feel free to reach out to Lyles Parker. Then also information is up on the PowerPoint. Other than that, have a good Wednesday and take care.